Thank you, Professor Gupta, for joining us and to answer some of our many patient questions. Just as by introduction, Professor Diraj Gupta from Liverpool Heart and Chest Hospital, who is also a member of the AF Association Medical Advisory Committee. Thank you.
You're welcome. It's always nice to be chatting with you.
So we hear a lot about anticoagulation therapy, but that doesn't treat the atrial fibrillation and the feeling of the pounding in the chest, the bag of worms, the exhaustion, the tiredness. So if we could talk about some of the treatment options, and if we start with medication, what is the difference between rate control and rhythm control for AF?
Okay, well, essentially, atrial fibrillation is characterized by an irregularity of your heartbeat. And often your heartbeat is irregular and it's also rapid. And that's what people feel as palpitations. So when you talk about rate control, essentially what you're saying is that you will allow the patient to stay in atrial fibrillation, but you will reduce their heart rate during atrial fibrillation and hence make the patients relatively free of the symptoms of palpitation. And you can do that by using medications such as beta blockers or calcium blockers. Now, with rhythm control, you're trying to get rid of the atrial fibrillation per se and get them back to the normal rhythm, sort of healthy sinus rhythm. And if you do that, then by definition, you also achieve rate control because now the patient is back to normal rhythm. Now, how you decide between rate control and rhythm control depends upon a number of factors. Depends upon the age of the patient, depends upon their symptom status, depends upon whether they have other comorbid conditions, which might influence the success rate of a rhythm control strategy, etc.
Thank you. And for those that are asymptomatic with atrial fibrillation, they can be anticoagulated, again, to help reduce the risk of an AF-related stroke. But should they be taking any rate or rhythm control medication?
That's interesting. So now it depends upon whether the patients are asymptomatic after being put on medications, and that we can certainly see that. So there are people who have had symptoms from atrial fibrillation, and now they get put on beta blockers, for instance, and their symptoms disappear. So in those cases, clearly, they have to carry on taking the medications. What I suspect your question is more for those patients who've never had symptoms from atrial fibrillation, and they've just been detected to have atrial fibrillation incidentally. And then the question arises, well, do they need any medications other than the oral anticoagulants? Well, in almost all cases, they don't. However, the only exception would be if their heart rate has been seen to be very rapid, then over time, this can wear the heart down and cause a condition called tachycardiomyopathy, where your heart function becomes compromised over months and years. So in that case, your cardiologist might decide to leave you on a low dose of a drug like a beta blocker, just to make sure that your heart rate is well controlled. And so it prevents the heart wearing out over time.
Thank you. You mentioned beta blockers and patients with AF being prescribed beta blockers. One person says they have asthma and the beta blockers seem to make their breathing more difficult. Others are saying, can I drink alcohol or whatever alternatives are there to beta blockers?
Well, that's a good question. Beta blockers are excellent drugs, but they can't be used in everybody. So bronchial asthma is one such contraindication. Certainly if you have brittle bronchial asthma, or if you need a lot of inhalers, then beta blockers are not necessarily the drugs of choice. Now, the good news is we do have alternatives to beta blockers. For example, there are calcium channel blockers such as verapamil or diltiazem. Those are often used to slow the rate in patients who cannot take beta blockers. Or you can even use digoxin or digitalis. It's been around 50 years, if not longer, and is still very effective to slow the heart rate in atrial fibrillation. You asked about alcohol. There is no reason why people cannot take alcohol when they are on beta blockers. Having said that, alcohol is a well-known trigger for paroxysms of atrial fibrillation. And so our general advice when patients are suffering from atrial fibrillation is to limit the alcohol intake anyway.
And for some people with AF, they have low blood pressure. Is it safe to have beta blockers then?
It depends upon whether your low blood pressure is symptomatic. So if it's causing dizziness, then clearly your low blood pressure is low for you. If on the other hand, you can have patients whose blood pressure is only 100 millimeter mercury or even 90 millimeter mercury, but they are managing to handle that very well and they don't get symptoms of dizziness. And in those cases, you could put them on beta blockers. As a general rule, it's your symptoms, the presence or absence of symptoms, that will dictate whether or not you can take beta blockers rather than just an absolute reading of your blood pressure.
And if you've been prescribed Flecainide and been told that it should be initiated whilst in hospital, but they're at home, what should they do?
Okay, well, Flecainide is a very effective drug for atrial fibrillation, and certainly it's a drug of choice for me as well. The only slight problem with Flecainide is that in a small minority of patients, say 1 or 2% of patients, it can predispose them to serious arrhythmias or ventricular arrhythmias. And usually that manifestation can be seen on the ECG. So if someone is predisposed to developing a untoward effect from Flecainide, you can see it on the ECG. So what we tend to advise for patients who are started Flecainide out in the community is for them to get a 12-lead ECG done a week or so after they've started the drug, and have that 12-lead ECG reviewed by a cardiologist to ensure that no untoward effects are there. And usually that's enough. We don't need to admit patients to hospital to start Flecainide, not least because it can often take 4 or 5 days for the full effect of Flecainide to come through, and you don't really want patients to be spending 4 or 5 days in hospital. So it's a very reasonable option to start them on Flecainide at home, get a 12-lead ECG done after a week, get that reviewed by a cardiologist, and if it's okay, then they can just carry on taking Flecainide.